So withdrawing from the World Health Organization would disadvantage the United States in quite a few ways. So we would lose a lot of the communication and visibility that we have on global health issues because we would no longer have American citizen and US government secondees inside the World Health Organization, which provides a lot of really important informal channels for communication. But we also would not be part of the formal reporting that WHO member states enjoy. And it would also mean we lose influence over major global health policy and practical decision making. So every year, WHO helps to convene the design of the annual flu vaccine. Obviously, the U.S. has a pretty strong interest in that. We would lose a seat at that table. We currently have a seat at the table when WHO is considering the declaration of a public health emergency of international concern. We would lose a seat at that table. It would also put at risk public health investments that the U.S. has made for many years. So the U.S. has been a huge supporter over the years of global polio eradication, and that's something that is being co-led by WHO. And so we've been able to rely on WHO with U.S. support and partnership to take that initiative forward, and they've done a truly excellent job of it. And polio is very close to eradication now globally. Um, Things like that and other global vaccination efforts are put in jeopardy by the U.S. withdrawal because the WHO would lose the U.S. technical partnership and would lose the funding that the U.S. government provides. There is really no one else in the world who can substitute for the WHO for those kind of functions. Uh, Global polio eradication will be led by WHO, period. So if the US withdraws from WHO, we are in effect withdrawing from global polio eradication rather than vice versa. And I think in the long run, even in the immediate run, what this kind of a decision does is it isolates the US more than it isolates the WHO. I'm not optimistic that other countries would be able to step in and fill the funding vacuum or the technical vacuum. The US, the depth of technical expertise that the United States has through our Centers for Disease Control and National Institutes of Health and other health institutions, um, really can't be replicated or substituted anywhere else in the world. There are other countries that have public health institutions that are very strong, um, but there is a long-standing and very deep partnership between CDC and WHO, and I think it would take time to even partially fill the gap that would be created if that was severed.